Okay, parents, your kids are going to turn out just fine.
This episode of the podcast is brought to you by FOCO. That's FOCO, F-O-C-O. If you are a parent of a child or teen with ADHD, you know how challenging it can be to keep them focused and engaged. FOCO is the all-natural solution for ADHD, whether it's for school, homework, or just everyday activities. FOCO helps your child or teen stay calm and attentive. Before trying prescription drugs like Adderall that can come with harsh side effects, I recommend you try FOCO. Visit ThinkFOCO, that's ThinkFoco, thinkfoco.com for more information. Welcome to the podcast. This is Your Kids Will Be Fine. I'm Dr. Michael Malopsky, board certified pediatrician and parent of 7. As my audience knows, Your Kids Will Be Fine is focused on helping parents overcome the information overload and help us with making parenting decisions with less anxiety and more confidence. Special guest on the podcast today. Many of you may know her and seen her work, Dr. Elisa Song. Dr. Song is a UCSF, Stanford, and which other NYU trained pediatrician, so trained at the top of the pediatric world, who specializes in functional integrative wellness, especially gut health for kids and how that impacts overall childhood health and wellness. And I am so excited to have you on the podcast today, Dr. Song. So I was going to focus my questions around the kinds of things that I get in my office as someone who's practicing in primary care, as you are a busy pediatrician as well, in a relatively educated community. And most of my families are 2 college-educated parents and are clearly invested in this topic. So first off, what defines, or how would you explain to families the gut-brain connexus and gut-brain axis, and then how those impact overall health and wellness topics? You don't have to get too granular, but I always struggle when I'm trying to explain this in a way that is digestible, especially in the context of a well visit, which, as you know, can sometimes be 10 minutes.
I guess I have the luxury of my well visits are longer, but it's still something that we have to be able to explain quickly because attention spans are short. and we want kids and parents to understand, right? It's not just parents understanding. And as you know, right, as pediatricians, our patient is the child in front of us, but we have to work within that team setting. And so the way I talk to parents and kids is just explaining to them that their gut and their brain communicate, and it's this 2-way information highway, something called the vagus nerve, and 80 to 90% of that communication actually occurs from the gut to the brain. So if we're dealing with any sort of brain issues, mental health concerns, ADHD, anxiety, these things are skyrocketing in our kids, right? So if we're thinking about a brain thing, it actually is a gut thing. And, then I dive into, well, what is the gut microbiome? It's this ecosystem that lives inside of you with hundreds of trillions of microscopic organisms. And those organisms actually are there to help us if they are the right kinds. And that they are comprised of bacteria like our probiotics. And our probiotics are actually responsible for making the vast majority of many of our neurotransmitter brain chemicals for us. And I think where parents often and kids often really lean in is when I describe to them that 80 to 90% of our serotonin is actually made by our gut. Now, some older kids, especially in high school, they'll have heard of serotonin. But for the younger kids, I'll say, well, serotonin is actually the chemical in our body that helps us feel calm, helps us feel relaxed, helps us manage stress, helps us fall asleep. So if we are feeling any of these things, the chances are we need to look at the gut and make sure that our gut microbes are able to make that serotonin for us.
So is it safe to say that the microbiome is the action point of the communication?
Absolutely. Yeah. It's right?
It's central. And so focusing on that issue is central to so many things. And so I there's a couple directions I wanted to go with this, but first I want to talk about, and I'm sure you see this in your practice, but the 2 major public health issues that for children in 2025 are clearly, 1, obesity and prediabetes, with now over 20% close to adolescents meeting those criteria by numbers, and mental health. It's no mystery that we have been in a mental health crisis with the number of books coming out. The most prominent recently would be Dr. Haidt's book on rewiring of childhood, and
Yep.
that gets a lot of traction. But in general, I think we can all acknowledge that there's a nationwide mental health crisis when it comes to anxiety, depression, suicidality, ADHD, if you want to throw that in there as well. So let's talk about how that concept that you brought up, let's talk about how it impacts specifically maybe these two topics, because
Yeah.
they're the two biggest public health topics that we are currently faced with as pediatricians.
Yeah, they really are. And I do really believe that if pediatricians, actually OBGYNs even, starting from before babies are born, could really focus on the gut microbiome as a core piece of their education, their anticipatory guidance, all the preventive care that we're trying to do, we could do so much to help resolve these crises. They really are crises. After the pandemic, statistics came out for our adolescent girls that 1 in 3 teenage girls has seriously thought of suicide, and 1 in 4 actually has a plan, and that is alarming to me. I have a 15-year-old daughter, and it's always in the forefront of my mind to just check in with her and just make sure that I'm in tune with what's going on in her head. But when we look at our gut brain connection and really focusing on the fact that our gut makes the majority of our neurotransmitters, it's not just serotonin. It makes up at least 50% of our dopamine, which is our focus, reward, attention neurotransmitter. And our gut actually makes 400 times the melatonin that our brain does. And when we're talking about processing and ADHD, we're looking at acetylcholine, which is made by our gut. So understanding the foundations of a healthy gut microbiome sets the stage for a healthy brain. Now, one of the things that we see, of course, as pediatricians, not you and I, but just in the overall medical community, is that antibiotics are way overused and misused in our children and our teenagers.
This was
Right?
on my list, because,
Yeah.
and I'd say most of us, I don't want to interrupt you, but hopefully it has a purpose, that in my practice, because two working families are 70% of my, two
Yep.
working parents are 70% of my practice. By the time these kids are between 1 and 3, are averaging 2 to 5 courses of antibiotics. So what can parents do?
Yeah.
Given that is the reality. And I agree with you. I think a lot of them overprescribed. So let's start there.
Yeah.
Absolutely misused and overused. And that's a whole topic, and you could have a whole podcast on that. But
It's
given that reality, what are busy parents to do if they want an actionable thing to heal and repair that situation, to what you said, to your point, preserving this for long-term mental health and metabolic health and wellness.
Of course, you and I know that antibiotics absolutely have a place. It's just that they don't have a place
Of
nearly
course.
as often as we think, right?
Correct.
And so
Especially
that's right. I mean, in one study, it was shocking. And as I was writing my book and really going through the numbers and the research, in some studies, up to 70% of antibiotics written for children are inappropriately prescribed. Now, why is that so important? Especially in the younger years, as you mentioned, by the time kids are 2, the vast majority have had at least 1 round of antibiotics, if not more. And studies have shown that antibiotics given in the first 6 months of life, and actually even within the first several years of life, can significantly increase the risk of mental health concerns later in childhood and adolescence, something by up to 50%. And we know this from adults too. With adults, even just 1 round of antibiotics can increase subsequent risk for anxiety and depression after the antibiotic course. And so, and we're not even talking about the allergic phenomena with allergies, eczema, and asthma. Antibiotics have been shown in the early stages, if not followed up by a gut supporting regimen, to increase significantly the risk of eczema, asthma, and food allergies, which, I mean, I haven't seen, during residency in medical school, I didn't really see kids with anaphylactic food allergies. And now it's just alarming
rare.
how many kids need. I mean, 1 in 12 kids now has anaphylactic food allergies. That's shocking and startling when we understand that your gut microbiome lays the foundation for the development of your child's immune system and the development of their brain and neural connections. And we touched briefly on the metabolic health. Your gut microbiome actually makes GLPs, right? GLP-1, which is now everyone knows about GLP-1s with Ozempic, but your gut actually makes this compound for you that helps control and normalize your metabolic health. So it really does all start in the gut. I mean, we could talk about any health issue, it starts in the gut microbiome. But, when we talk about antibiotics, this is really important because I want parents to feel empowered when they're going to urgent care or the emergency room. Let's say, I mean, kids tend to get sick in the middle of the night, right? It's usually not, during the middle of the day when you and I can have a conversation with them. So if you go to urgent care and let's say an ear infection, which is very common.
Just as an aside, I'd say in my practice, the majority of we focus on this topic, but the majority of inappropriate antibiotic prescriptions do come from retail urgent care. So that's
Yes.
just my
Yeah,
so continue.
absolutely.
Yeah,
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 yeah, retail urgent care. I haven't heard that term, but yes, that that is
yes.
yeah. And
Retail
so,
urgent care.
when you go and you can see it's like every 5 minutes seeing a patient, a kid who's sick, and it's in the middle of the winter, right? I mean, and I've been there. I used to moonlight like that before I started my practice. And the fastest thing to do is write a prescription and here you go, right? But we
Yes,
know that the vast majority of ear infections will resolve without antibiotics, even if they're bacterial, actually. And which is why,
absolutely true.
right? Which is why the American Academy of Pediatrics recommends a watchful waiting period for most kids of 48 hours, 72 hours before starting antibiotics. But
Almost regardless of what the exam looks like, actually
that's
now.
right. That's
Yeah,
right. And so I want parents to understand that. And then when you're at the urgent care and you're given this prescription, the number one question I recommend parents ask the doctor or the nurse practitioner or the PA, whoever's prescribing, is asking, "Hey, doc, is this prescription really necessary?" Now, the reason to ask that is because in one study I looked at, doctors were twice as likely to write a prescription for an antibiotic, even if they thought it was inappropriate for a viral infection, if they thought that the patient wanted one. Right? So if you
yes,
simply ask the question, the doctor or the nurse practitioner will stand back and know, okay, I'm not the parent who's coming in simply for a prescription, because there are parents who come in who want that the goal is to leave with that prescription. But you
right,
guys listening to the podcast, I know you are not one of those parents. So you ask the question, not in an adversarial way, but hey, doc, is it necessary? Then the doctor can say, actually, what the guidelines say, we can actually wait. Now, here's the problem though, because then your child's still in pain. So what do you do? Right. So from a conventional pediatric standpoint, there's not much that we can do. But from an integrative, more holistic pediatric standpoint, there's lots of tools. So we know garlic eardrops in some studies
yeah.
have actually, there's evidence to, resolving ear infections quickly and resolving the pain quickly. That's the worst part of ear infections is the pain, right? And
Mhm,
the amazing
yep.
thing about garlic is that it has antiviral and antibacterial and
So is it this is an oil form, correct? Like garlic
antioil
oil.
form,
Yeah,
right?
I've actually been doubling down on that a lot more.
And you put it in your ear, you don't drink it, right? You put it
Yeah,
right
yeah,
in the
yeah.
ear and it can diffuse through the eardrum. And, a lot of ear infections are mixed flora. So what that means is there's bacteria and there's virus. And sometimes when eardrums are perforated, I've actually cultured out fungus or yeast, right? So you can have all three of these. Antibiotics only kill the bacteria, which is why oftentimes antibiotics don't really work that well for an ear infection, or it, kids feel better but then they start to feel worse again because maybe the virus or the fungus have kicked up. So the garlic eardrops are
Right,
phenomenal for that. So,
right.
learning about these integrative, more natural tools can be really beneficial.
And then, but let's take the scenario where uh, they end up and they've been on one or two courses of antibiotics. What do you feel are kind of the most actionable best steps for parents after the fact to help restore or heal that issue, knowing, as you just pointed out, the central and foundational importance of maintaining and building this environment in our children for long-term benefit. So what can parents routinely do? Just maybe the most actionable, the most easy, the most accessible after they've been on these medicines,
Yeah. Well,
even for necessary
yeah.
reasons.
Well, the first thing I just want to tell parents is if your kids have had antibiotics in the past, it's done and we can
Right.
move forward, right? It doesn't do any good to, sit and think back about oh my gosh, I gave my kid antibiotics at 6 months of age and now they have eczema or now
Well,
they have
and if your kid had a terrible UTI at 6 months of age, it was a
that's right.
necessary
Yeah.
thing. So right. So taking the situations, where do parents move forward for their
Yeah.
most impactful benefit?
It's always about moving forward. And so many parents are probably giving their kids probiotic supplements or at least have heard of probiotics, right? They're
Right.
so readily available. I will say that's part of the healing piece, but not the most important, right? The most important is really getting your child's microbiome and frankly our microbiome. So many of us as adults have had antibiotic after antibiotic when we were kids, and now
Yep.
we have allergies or anxiety or whatever we're suffering from, right? And so I talk about in my book the 5 things for microbiome magic. Those are things we do every single day. It really is how we're eating and living that make a difference for how resilient your microbiome will be. And those foundations include the foods that we're eating. Your microbiome, the beneficial bacteria, need fiber. They need color in our diet, the phytonutrients, and they actually do need fermented foods. In fact, fermented foods have been found to increase your microbiome diversity, even better than fiber. So really, I
Exactly.
know, even kids may be picky, but it's always a work in
Yeah.
progress. We work on the foundations because otherwise I can throw, a gazillion probiotic supplements in your gut. They're not going to stick, right? It's if you think about growing a tomato plant, you can't just throw the seeds in the ground, ignore it, not enrich the soil, give it water and sunlight and expect the tomato plants to grow, at least a healthy one, right? So we need to create that soil, the ecosystem where those probiotics actually want to stay. Now, with that foundation, yes, you want to choose a probiotic supplement that is as what I would call broad spectrum as possible, meaning many different microbes. We have trillions of microbes in our gut. So it doesn't make sense to just pick a few. One of the most important ones to get back in is a family of bacteria called bifidobacteria, because those lay the foundation for really establishing healthy gut, neurotransmitter production, vitamin production for us, right? And
Yes.
then, chances are your gut lining needs a little support too. So there can be supplements like glutamine that can be very helpful. Fish oils and zinc are often really, really needed. So there's a regimen you can do. I would say, okay, now standing back as a parent, I'm listening. What should I start right now? I would say getting a really good high quality probiotic supplement. If your kids are not eating a lot of fiber, I would get a fiber supplement or a prebiotic supplement. And in
So
fact,
can I ask 2 questions about this because I get this all the time, and the truth is, I still am not completely sure. Is there an easy way for because parents are inundated
yeah,
on Amazon and in my office alone, the Culturelle lady drops off literally a case of these little
yeah.
packets. Is there a convenient way for parents to be able to separate this one is better than that one? This one is more likely in the context of what you pointed out. And I always say probiotics don't work unless you plant the soil or unless you develop the soil. So the fiber, the color, the foods. But is there any convenient way for parents to tell the difference in terms
Um,
of the
yes,
quality? So you said
there
you
is.
said
Yeah.
diversity of strains, focusing on bifido. So that's one. Is there any other way for parents to know this one's more likely to be better than
Yeah,
that
I
one?
mean, you wanna, see what I mean, I don't expect parents to really comb through the literature, right? And,
Yeah, no, but I
right?
mean, when you're looking at it, if there's a way for a parent to look at a product and be able to have some better
Yes,
idea,
yeah.
that's
So I will say, something like Culturelle and also Florastor, which is Saccharomyces boulardii, is a beneficial yeast. Those are readily available, and those actually have been studied to help with post-antibiotic recovery. Now that's more
I've heard Floristore as well, and they can
mhm.
open the capsule if they need. Yeah.
That's right, and it even comes in a powder that's easily dissolvable. They're just 2 strains. One of them, Cultural is Lactobacillus rhamnosus GG. It's the most widely studied strain in kids. Really good studies. So I do feel comfortable with
Right.
Cultural and Florastor, lots of good studies. I would say those are probably if you're just immediately on antibiotics and you're trying
Yeah.
to, recover, those would be the 2 I might go for. Otherwise, if it's been several months or a year or years, then we're looking for, more strains in your
Yes.
probiotic, right? And then really looking at what I like to see from a manufacturer is that either on the bottle or on their website that they list the actual strains used, because those strains, then I know that the manufacturers put some thought into, hopefully put
Mhm.
some thought into which particular strains of probiotics they want to put into this
Yeah.
supplement, right?
Yeah.
So for instance, Lactobacillus rhamnosus, GG, which is in Culturelle, it's a great probiotic. I would like that strain in a kid's probiotic. But if you just see Lactobacillus rhamnosus, you don't know if it's the strain GG, which is actually the one that you want. So if you'll see a whole host of strains. I would say looking at that, looking for maybe anywhere from 5 to 10 different kinds of strains. Ideally, there would be a prebiotic in that probiotic as well, something like inulin, or you might see FOS or GOS, because again, the probiotics need something to feed on. However, if you're taking a separate fiber supplement with the probiotic, that's not completely necessary. So does it need to be refrigerated? Not necessarily. I mean, the technology has gotten better. So now you can find some shelf stable. The ones that I've had, and I actually do microbiome testing, so stool testing, to really fine tune how I want
I
to.
I was going to ask about that in the average pediatric setting. Obviously, when we have patients who are looking for this specifically, and then we can spend more time with them. But let's say in the average setting, is that does that drive or change a lot of things? Would you recommend that on a routine basis?
I Yes, if it's possible. I will actually also, just full disclosure, I'm the chief medical officer for a microbiome testing company called Tiny Health. Tiny Health.
Tiny Health. I just
Yep.
want to be able to give our families resources when they're
Yeah.
asking about these things, that
Um,
of places that do it right
yeah.
and make it. I think it's a couple things. One, do it right, and the results can be understood by an average health provider to make it actionable.
Yes. And Tiny Health actually has an amazing interactive portal for patients and practitioners, where if you get the
Okay.
results, there are actionable steps that you can take. They'll recommend certain foods and, lifestyle. If supplements are a consideration, they actually have some suggestions that um, through Tiny Health testing, we found actually these supplements work, because we don't want you just throwing your money away on various supplements, right? Now, the beauty of Tiny Health is if you have a kid anywhere from 0 to 18, it has specific reference ranges for what the microbiome should look at different ages. It's the only test for age specific ranges, and the only one that really is appropriate for young kids. Your microbiome between 0 to about 3 years of age is shifting really rapidly. A baby's microbiome looks complete, or should look completely different than an older kids and a teenagers and an adult microbiome. And there's also variations as kids go through puberty, because our sex hormones cause our microbiomes to change too and split in different directions. Testosterone has different effects versus estrogen and progesterone. So as we get older, I mean, even, I'm going to say for me, as a kind of perimenopausal, menopausal, microbiomes change again. As we get older through senescence in our 70s, microbiomes change again. And so we want to ask, well, what should our microbiome look like for me with my specific sex and age, right? And so Tiny Health has been amazingly valuable to be actionable. And that's where I think for a busy pediatrician, having these, action steps to recommend to patients, and even patients can look on the portal and see, what could be ideal. So
So this can be self-administered by the
it
patients.
can
They
be,
can
it can
they
be.
can log on, they can order it, they can do it. And it sounds like maybe just being given permission or encouragement by your primary care doctor can sometimes be the difference between taking that step or continuing to just go, well, my doctor never mentioned it.
I love
Yeah.
that, how you're phrasing that, because yes, we have to also put ourselves in the shoes of most parents are going to be in a setting
Mhm.
where you're right. I mean, 15 minutes for a well visit, there's not much time to discuss a ton, right? And I'll give you an example from the mental health standpoint. I had this one kiddo, she was 10, and she had a lot of different initials she had been diagnosed with: ADHD, OCD, ODD, so many issues, right? And her parents and she were really struggling. She just was, aggressive meltdowns every day, everyone walking on eggshells around her.
Yeah.
She was
Probably on the medication carousel
Yep,
of,
and she had
nothing's
tried
we keep
actually.
on and on. Right,
Mhm.
exactly. Yep.
And she
See
had
it all the
tried
time.
many medications, but
Yeah.
had to stop because it was affecting her appetite too much, and now she was losing weight, getting food restrictions because she had been nauseous and was afraid to throw up and, I mean, all the things, right? So, they came to me kinda, desperate, and so I said, I explained the gut microbiome because otherwise, if you're coming into a pediatrician, with severe mental health concerns and they're telling you, "Hey, let's do a poop test," you're like, "Why?" So, I explained the microbiome, right? We
Right.
did the poop test and we found high levels of this particular disruptive microbial family called Enterobacteriaceae. It's
Yeah.
gram-negative bacteria, and they
Right.
produce this highly inflammatory compound called LPS. I would not have known that if I hadn't looked. And so I gave her supplements to get rid of those bacteria, get rid of the LPS. And
What are the strategies when you see a massive imbalance? Let's take this one. And the reason why this really uh, interests me is because we run our own adolescent mental health clinic. Our mental health, because it's doctor led and it's community based, inevitably we attract the more complex
yeah,
kids that are failing the medication carousel from the nurse practitioner run pill mills that are basically showing up all over our community for mental health. And so when you see a massive shift, what is the most effective regimen that you start? Because I have a sense that if we started looking for this when I'm thinking of my own complex mental health patients, we're going to be finding more of this. So
yeah, yeah.
how would you address that? Because the mental health thing is huge. It's a massive part of our regular practice. Let's talk about that. You said, how would you approach this patient specifically?
Yeah. Well, the first thing, I did was really talk about the foundations of
Yeah.
what the microbiome is and how to support the microbiome. I planted seeds on, you know, suggested diet and lifestyle changes because especially for preteens and teens, just throwing at them, hey, eat more fiber, that's not going to do it. Right. So I really explained to her, educate her on why this was so important. And actually that night, the mom emailed me and said, "I can't believe it," but she actually was willing to try some broccoli on her plate because she had heard, because
Right.
she wasn't happy with herself and she didn't like being in her own mind. It wasn't serving her, right? And so that's so much of it because we need to start working on the diet.
Right.
That's
And
where
so we know that not just diet, but sleep, exercise, all those
absolutely.
things impact that. So yeah, the big picture, the lifestyle things, and like you pointed out, the basic supplements, which I make it part of every mental health encounter, the omega-3, the
Yep.
magnesiums, the
Yep.
zinc, the
The
broad-based trace mineral, trace nutrients.
And
But
then with the imbalances, what I
yeah,
actually did, so this is a time where I did use antibiotics because I
interesting.
I
Yeah.
know those organisms we can clear out, and I used an antibiotic called Bactrim, right? Trimethoprim, sulfamethoxazole. I have used herbs. There's cinnamon actually works great against a lot of these organisms, but she was
Right.
in crisis. If she hadn't been in crisis, I would have said, let's try an herbal route, right? But I also
Right.
worked with the parents to find out where they were at and what they preferred. And they preferred the 10-day course of antibiotics,
Sure.
followed it up. I give them a really great prebiotic supplement, a really broad probiotic supplement, and something called serum derived bovine immunoglobulin, which is the only thing that's going to
Is that like the same? Is that similar to the colostrum products that we
it's
see?
similar. There is some in
Right.
colostrum, but you really need to have a separate SBI. There's so many colostrum products on the market out there. I think they have some value, but not in this case. We need SBI. And within a week, the mom said that she was noticing a lightness about her. And then
Right.
in just one short month, the mom wrote back and literally she said, "We're getting our daughter back." And
It's
so,
amazing, and I'm not surprised to hear that because I'm seeing it more in my own experience, and the issues that I see with our psychiatry and nurse practitioner med community, and they have a role because accessibility to these things
yeah,
continues to be an issue, but they don't address this at all,
yeah.
and it's zero part of the discussion. Did you have what probiotic in this setting when you were recommending? What was the probiotic? Because this setting is so common and so important, and I know to our audience, so many of their kids. What did you pick specifically for your probiotic to address this particular
Yeah,
scenario?
that's such a great question. So I actually picked 2. Because so the first one was a really broad spectrum probiotic, and I used something called Orthobiotic by
Mhm.
Orthomolecular Products that has many different strains, and it has a Saccharomyces boulardii. I've also used Clear Labs has their Therabiotic Complete or Children's Chewable. They've been on the market. They're one of the best probiotic manufacturers really in the world, and they've been at this for longer than most companies, and they are still tried and true great
Mhm.
supplements. And then on her stool test, her tiny health stool test, we could see that she did not have any GABA producing species. And GABA is a very calming neurotransmitter
Yeah.
like serotonin. So I chose a probiotic. So as a backup, parents should know there are their probiotics have many different functions, and there are many different probiotics that can have these functions. But we have to know again the strain. So, for instance, there's a whole category of probiotics that are now being called psychobiotics because they help support healthy neurotransmitter production, right? And they're
Mhm.
very specific strains. And so the strain I used a supplement. It's by a company called Healthgevity, but they have a supplement called Serenity that has a Lactobacillus plantarum. I think it's called LP815, LP815, that is a GABA producing strain, which I wanted for her. So I was
Got it.
targeted in what I chose. And that supplement also has theanine, it has saffron, which at
Mhm.
30
Yep.
milligrams has been shown to support ADHD, even better than Ritalin. It's in your FOCO supplement, right? It has theanine. So there are a whole bunch of other herbs in it, but otherwise, I look for that specific probiotic. If I'm looking to enhance serotonin or dopamine, there might be other probiotic strains.
Sure. Understood. One of the great debates and great questions that I get when parents are choosing, and I think it's great with not necessarily, hey, I'm not in a crisis. I just want to optimize. I know how important this is. I'm trying to pick the right things. I hear a lot of different um, positions around the gummy versus non-gummy form, especially for fiber and especially for micronutrients and other things. And so the GI community tends to counsel people that gummy forms tend to be less effective because they deliver less effectively in whatever physiologic way that they explain it. I'm curious what your experience is because the gummy forms are so valuable for a lot of parents to at least get them started and it's
Yeah.
accessible and they take it. Nothing helps if you don't take it. But on the other hand, there's messaging from the traditional PGI community about gummy forms are bad for for delivering lots of these things. Let's talk specifically about fiber and probiotic form right now.
Yeah. Probiotics are probably not best delivered through a gummy form unless they're a spore probiotic because with gummies, I mean, if anyone's ever made Jello, you have to heat up the gelatin and and then cool it down, and so
Yes.
probiotics are heat sensitive, so not for probiotics. I think for fiber as prebiotics, it can be a great delivery system, you know.
Okay, great.
And I've used gummy. We used to have a line of gummy vitamins, and I do check blood work regularly, and I've
Yeah, yeah.
seen blood levels increase, right? So I
So
think
so
they can be
gummies deliver
fine.
fine for those big things. Probably stay away from gummies. Stay away from gummies for probiotic delivery. It sounds
Yep.
like.
Yeah, and then, but yeah, I think, and especially to your point, some is better than none, and for some of these kids, they just need more nutrition, and so if that's gonna be a way until we can up their diet, if the way that's gonna be an acceptable, format for delivering the supplements, until they can learn how to swallow, right?
Yeah,
Then yeah. The only thing I really look at carefully is the added sugar content because
absolutely. Yeah. Sugar. You've made this very clear when I've been using your book a lot more in the last few months. But sugar is a microbiome killer. It's like Roundup weed killer in the fertilizer of your gut. And so, do you, considering that it's impossible to avoid completely, do you advise parents to stick to a total number, or is there a number that's ideal? Is that knowable from a
from a sugar standpoint, and I talk about this with my kids, they're teenagers now, and
yeah?
we talk about this all the time. They know that, at a maximum, kids 2 to 18 years of age should have no more than 25 grams of added sugar. Now that's a little, most of us don't think in grams, so that's the equivalent of about 6 teaspoons of added sugar. But here's the sneaky thing that I
Yeah.
describe in the book is we don't know how much sugar we're getting unless we actually look at the labels of the food we're eating. Because sugar sneaks in bread, in cold cuts, in spaghetti sauces,
Sure.
right? Salad dressing. So you have to look. And the average teenager today doesn't consume just 6 teaspoons of added sugar. The average teenager consumes 34 teaspoons of added sugar in a day because just, one frappuccino, grande mocha, whatever thing, or one boba tea can have upwards of anywhere from the highest one I found was this grande mocha frappuccino from Starbucks, something like that. And it was 55 grams of added sugar. That's over 9 teaspoons right there. And think how fast
Right.
you can slurp down that sugar, right? You couldn't spoon in 9 teaspoons of sugar that fast, but you can certainly drink down that.
Well, that's why I think, and when I counsel patients, I always say liquid sugar is the worst
Yeah.
version, the worst form, both metabolically because it's not filtered by anything, so it goes right into your system,
Yep.
hits your insulin pathway. But yes, also it's way easier to consume, way higher amounts. So, so it sounds like um, it's never too early. One of my questions was, but I think in the course of our discussion we answered it. This is a topic that should be in front of parents or on your mind or in your priority list, literally from going home from the hospital with your
Yes.
baby,
Yes.
right? And so we have a very, very high amount of new moms and newborns in our practice, as we're lucky enough to have. I'm assuming my assumption has always been, and is that a successful breastfeeding dyad pretty much autopilots this most of the time. But what about for the families? I also happen to have a very large population of highly medically complex children, complex NICU grads, just because of my career as a hospitalist before I started my practice. So I attract that. And many of them don't have that opportunity.
Mhm.
So let's say in the earliest, youngest kids, where for multiple reasons, for medical reasons or just individual reasons, breastfeeding just
Yeah.
didn't quite work. What are the ways for parents to support this from the earliest phase?
Yeah.
Breastfeeding is obviously the best and most it's autopilot for your microbiome. I'm assuming early on, but give me some things for these parents of infants where that's not possible and who are more medically complicated and don't
Yeah.
have the opportunity to do that.
Yeah. It's such a great question because if we can start babies off on the right footing, we have a much higher chance of setting them off on the best footing for their preteen and adolescent years for health, both
Yeah,
physically, immunologically, and mentally. And and also just as a note too, unfortunately nowadays breastfeeding, isn't a guaranteed path. What There was one fascinating Scottish pathologist who looked at breastfed versus formula fed babies' microbiomes or poops 100 years ago. Now, of course, the testing wasn't similar. It wasn't like what we have now, but he cultured the stools and found that back then, breastfed babies had nearly 100% bifidobacteria. Formula fed babies had more of a mix, some bifidobacteria, but also other species that were in there. It just shows you how important bifidobacteria is
yeah,
to babies, right? And breast milk has this unique prebiotic called human milk oligosaccharides that bifidobacteria feeds on. It specifically feeds bifidobacteria to colonize in the baby's gut. So formula obviously misses that, right? What now our modern day baby though, when we compare microbiomes, the breastfed baby's microbiome today actually looks much more like the formula fed baby's microbiome from 100 years ago. So things have shifted. Mothers' microbiomes have shifted, right? So ideally, I mean, if I had the luxury of being able to speak with every family before they try to conceive, I would want to get mothers and fathers' gut microbiomes in order before they even try. right? There's even fathers, right? Because father's microbiome before conception has actually been shown to affect babies' outcomes and pregnancy outcomes. So it's fascinating. But for a baby who's born, and let's say baby was born by C-section, or you're formula feeding, as you said, for whatever reason, we want to support the family where they're at. But we know that these factors, formula and C-section births, or antibiotic exposure during pregnancy or birth, for
I mean, we
groups.
see it a lot in the NICU. Almost all these
That's
kids who
right.
are sick
Yep.
to ensure,
Yeah. Have to, right?
avoiding a
Yeah.
life-threatening problem, and at least for 2 or 3 days in the vast majority, and
Yeah.
sometimes for 10 days.
So we know that microbiomes need support. And so, the most important thing I would say during those stages is to look for a human milk oligosaccharide analog, a prebiotic, right? And now there are companies that make HMOs, these HMO prebiotics, not from breast milk. They manufacture them, synthesize them, but they're available as supplements. And there's some really good studies.
Supplements to give to the newborn, to
Give
the
to the
baby.
baby. Yep. Yeah. And in fact, anyone who's low on bifidobacteria, I recommend it
Sure,
for even my adults who are
sure.
low on bifidobacteria. But there are studies looking at HMOs in full-term babies who are formula fed versus breastfed, and adding HMOs to the formula can make the baby's microbiome look more similar to the breastfed baby's microbiome. And then
Amazing.
same studies have been done with premature babies, right? And so very, very safe. Right now, there aren't too many manufacturers, but there are two. One is called Begin Health. So Begin Health has a HMO product for babies. They actually have a HMO plus a probiotic that's suitable for babies. And then Layer Origin has a prebiotic that's either a single prebiotic or a single HMO or 5 HMOs. It's called Super HMO for kids. And I love that idea because we have many, many different kinds of HMOs in our natural breast milk. And so it makes sense to try to have a lot of different ones.
And both of those are also safe for infants as well, I'm assuming.
So, I do give the 5 HMO, the super HMO from Layer Origin to babies, but on their labeling it says not for kids under 1. I think that really is more because they just don't want to go there.
They probably just don't want to spend the money to prove the proof of safety is
Yeah, yeah.
expensive, even though it's obvious that what would be there'd be nothing here that would be harmful.
Yes, because I
Um,
mean there are good research papers on using HMO babies and HMOs in infants.
so if you're a parent listening to this, I'm sure it felt like drinking from a fire hose. Um, so I want to give parents a quick resource. One, your book, Healthy Kids, Happy Kids. And I think it is an invaluable tool for parents and frankly providers, because I don't know I know Stanford has a pretty active pediatric integrative health department now, but this was not a part of my training at all. And I've had to spend an enormous amount of time and energy to educate myself. And of course, you're swimming upstream against a lot of the traditional Western pediatric conventions. And there's still, I think, a very suspicious and non-supportive, even if it's not
Yeah.
covert attitude in language and presentation about this when they communicate to parents about this, which is, I think, very problematic.
Yeah.
So your book, I think, has been hugely valuable for me as a provider, and I refer patients to it and parents to it all the time.
Oh, thank you.
And then second is, I think that maybe considering that parents have been drinking from a fire hose for this whole podcast, I'd like to distill it just down to what I took away as a parent and someone who treats kids. So of what are simple and actionable things. So the first is what you do every day with regular habits, starting from very early. There's no time that's too early to think about this. And there's no situation, whether that's antibiotic exposure or other health things, that wouldn't be helpful or addressed by initiating these even after the fact, even after multiple courses of antibiotics, even if they were necessary. So that's on the diet side, that's the fiber, the color, managing sugar, and managing the other healthy things like exercise and sleep all impact your microbiome. And the fiber, the maximizing the fiber, minimizing the sugar, create the healthy environment, the prebiotic environment. Two, fermented foods and diet choices from very early on. What I got out of the stuff I've been doing there, not all fermented foods are the same. As a parent, I know the first question is I promote kefir ahead of yogurt. Could you respond to that? Because so many parents say, "Well, I gave him 3 Go-Gurts that probably covers it."
Yeah, yeah.
Can you respond to that? Because
Well,
that's the most common fermented food that parents feel is actionable and useful.
yes, and I will say yogurt can be great. However, the
Yeah,
yogurt marketed to children is often not, and even
yeah,
marketed to adults, frankly.
sure.
I was shocked when actually finally look at the label because my kids are not babies anymore, but I saw this Stonyfield Yo Baby organic
Yeah,
yogurt,
yeah. It was in
right?
my house forever, Yo Baby.
And it said on the thing, number 1 pediatrician recommended yogurt, right?
Yep,
So I turned
yep.
over the label and I was shocked. So the guidelines are that babies 0 to 2 years of age should have 0 grams of added sugar. 0. They don't need extra sugar in their diets. They're going to get that soon enough when they're older. And each serving had really, I want to say almost a teaspoon of added sugar. There's
Yeah, yeah.
no need for
Not
that, right?
surprised.
So looking at the labels, I think if you're using, Greek non-fat, not non-fat. I love whole fat personally, right?
Unsweetened is Greek.
Whole fat,
Plain Greek. Okay.
non-flavored, plain Greek yogurt, that's great.
Right.
Add some chopped up berries and, but yogurt, dairy in general can actually be quite congesting and it can be, cow's milk products can actually be inflammatory to your gut lining. So
Yes.
I don't
Yes.
want kids to have a ton of dairy anyway, but,
Okay.
fermented foods like, sauerkraut, kombucha is one of my favorite. We actually
Okay.
brew our own kombucha at home. Um,
Okay.
Miso, if you from an Indian background, dosas. Every culture has their fermented food, so I love a variety.
Those in traditional Western diets, the way kids, especially when I talk to my kindergarten set, it's a challenging set of things to introduce.
It is. And so I in the book, I actually have recipes that help parents and kids think a little bit outside the fermented
Sure.
box because a lot of us are thinking, oh, sour, vinegary tasting, kids aren't
Yeah.
going to do it. But you can ferment just about anything, including fruit. And so I have a fermented blackberry lemonade recipe that I've made with my kids. I actually I created a 6-week elective. We called it Healthy Gut, Happy You for my daughter's 3rd and 4th grade class. For my son's 6th to 8th grade class, we renamed it to Guts, Brains, and Kombucha. um,
Ah,
but we made the lemonade in class that each kid got to take home, ferment for a few days, and drink
yeah.
it. They loved it.
Excellent point. So you don't have to just feel like, well, if my kid won't accept these 3 things, then I have to move on. You can find ways to do it. It sounds like in your book, you give parents a, a an action plan and a roadmap to be able to add more fermented foods at home,
Yep.
even if you're not necessarily going to be so successful with sauerkraut and kombucha with your 4-year-old. So the most important things are those daily habit positive lifestyle changes that you do every day to support and develop the microbiome, recognizing the importance of it and how it has so much long-term impact on your child's metabolic wellness, and mental health and mental wellness and cognitive wellness. And then probiotics, what to look for. You want a broad spectrum. You really want to look for things like bifido and the lactobacillus species, at least if you're just, hey, I want to start something. I want to support the health. I'm doing the right things to create the positive environment in my kid's gut, and then I want to add something. You can adding that something along those lines. We talked about Culturelle and Floristore is widely available and easily accessible, and we'll put up also on the website the other specific brands that you mentioned to give people more variety of possible choices. Microbiome testing shouldn't be discounted. It should be something that health providers, even if you don't necessarily, you don't have to carry the kits in your office, you don't have to have a separate visit, but sometimes just parents hearing it from us and feeling that, hey, we support it and give them permission makes all the difference in taking action. Let's close with when we're talking to pediatricians and parents, what are the biggest barriers that you see for the average well-meaning, on the ground pediatrician that's seeing 20 or 30 or sometimes more patients a day because they work in a high volume area. There's
Yeah.
high demand. We all know we don't need to have a rant about insurance and how that impacts this right now. And what are the biggest barriers to creating an environment where we can talk about this more often with our families?
Yeah. I mean, I think, one of the biggest barriers is just time,
Yeah.
but, we can't necessarily change that about the system. The systems do have to change, though. It is
Yeah.
time that they change. But I would say the biggest barrier in moving this forward to becoming a reality is just knowledge. I think once pediatricians I've had pediatricians who were very conventional, my friends who trained with me at UCSF, and they're like, "Oh my gosh, I had no idea about all of this." And really, they've heard of probiotics. Maybe they recommend them after antibiotics now, but really didn't understand how foundational the microbiome was. And then they're at least talking about it a little bit more with their families, or when families, read the book and realize, have those aha moments of, okay, we need to first look at the microbiome. That starts to shift how the conversation goes. And I think in a busy pediatrician's office, if an issue comes up, it helps you immediately just hone in on the microbiome and start talking about in a different way, because we're giving anticipatory guidance. We're talking about diet and lifestyle anyway, but if you can reframe it in a way that then for a child who has eczema, let's look at your gut. And this is how we can think about eating and living and all the things to support your gut microbiome.
Amazing. So with that, I think that's a great place to wrap up. Once again, everyone can find Dr. Elisa Song on Instagram. Her book, which I can personally vouch for the value of it, both as a parent and a pediatric provider, Happy Kids, which talks about actionable, practical ways to address this in your home and with your families that you take care of. And I'm really looking forward to seeing you in Denver when
Yes.
you come to the convention. And once again, for our audience, remember you can find our podcast anywhere you guys consume podcasts. So Apple Podcasts, Spotify. Don't forget to find this episode and all the other episodes on our website, yourkidswillbefine.com, where you can download the episodes as well as leave comments and show suggestions. I really can't thank you enough so much for coming and hanging out with us this morning.
Well, thanks for having me.